Hi, mamas. Welcome back to Momsibilities, a place where we talk real, honest, and unfiltered motherhood. Today, I am joined by a very special guest. Her name is Dr. Olivia. She is a naturopathic doctor, a birth doula, and the co founder of Downtown Doula. Hello, Dr. Olivia.
Thank you for
Welcome
having
to
me.
Momsibilities. I'm so excited to having a great conversation with you today.
Yes, me too. I love sharing what
Yeah.
being a mom is, but also the work that I do. It's very important, and I'm so glad that you're hosting me today, so I
Thank you
can do
so
that.
much. So, for the benefit of the audience, would you be able to just give a brief introduction of what you do? And let's talk in a layman's language what a doula is and what they do.
Sure. I will start it from the naturopathic doctor angle because that is how we address doula work as well. We do it through that lens. Naturopathic medicine is holistic medicine. It's trying to honor the body's own natural ways of healing and supporting it and looking at the bigger picture of health, the determinants of health and how we achieve health and maintain wellness. And so the doula work that we do through that is all those things are still valid. Having birth is a natural process. We want to optimize it and we want our moms and our families to be well. And the doula work, specifically, I'll start with the birth doula work, which is primarily what I do, is I prepare moms for that huge transition. I help them with their own fears related to birth. I'm physically there in the birth to help them cope with any discomforts. And so we do that education piece, that preparation piece, that in-person assistance. I like to make the joke that I'm who you wish your husband was in labor.
Yes, yeah.
But ideally, we also train our partners, whoever that may be, to support the
Wow.
moms in labor as
Awesome.
well. And then, we kind of make sure we keep in touch for a couple weeks, make sure that first little bit of time is smooth, and refer where needed or continue care depending on what clients choose. Yeah.
Dr. Olivia, being a naturopathic doctor as well, I'm just thinking, would it be like moms would choose to be with you from maybe the start of their pregnancy because of the support that they could get from you? It's not really in the third trimester when they really need a doula support, but being a naturopathic doctor, right?
I mean,
From that
ideally,
angle.
yes, ideally. I find most people find us later on in that third trimester stage looking for really the birth doula role. But yes, it would be most beneficial if people could connect with us earlier because there's so many things even in the pregnancy that can affect how
Exactly.
labor goes, including getting diagnosed with a medical condition that's sometimes preventable, which can switch you from midwife care to OB care.
Yeah.
For example, where naturopathic medicine could do that support and keep things on track, as best as we can.
Yeah.
Yeah.
So coming from the doula perspective, I have seen a lot of moms who don't have like a very good clarity about the difference between a midwife and a doula. And that's a huge difference, right? I would like you to shed some light on that.
Sure. The simplest way, who's responsible for delivering a baby? The midwife. The doula is not responsible for delivering a baby. We are there to support the family, emotionally, physically. That is the easiest differentiator. We are in Ontario, Canada. I know your audience may be wherever. So the roles here, because every jurisdiction is different
Yeah.
with their scope and what's allowed and what's not allowed for each practitioner. Midwives are regulated health professionals similar to obstetrics and gynecologists. So they are, you can sign up with them as soon as you find you're pregnant if they're available for your due date, and they will monitor your pregnancy health, they will deliver the baby, and they will follow up with you in the postpartum. And this is all covered through our OHIP system. It's considered
Right.
care, which is lovely.
Yeah.
Doulas are unregulated. So anyone can actually call themselves a doula.
What are you saying?
Yes, you could take a weekend course
Oh,
and
gosh.
call yourself a doula. There are standards.
Yeah.
There's, DONA, Kappa, and there's a few more always evolving and emerging. So if you're registered with one that I didn't mention, I'm sure it's there. And we ourselves are trying to, your downtown doula, create a standardized course material, so to speak, for naturopathic doctors who want to do this work. But yeah, anyone can call themselves a birth doula. But the main role of that is to doula, comes from, you hear this, you'll read this everywhere, the Greek, Latin term to serve. And originally it was, we were slaves, right? Doulas were slaves. The role would help birthing families because you would have many people supporting the birth, and it was largely a feminine role in the past. Today, you'll see the term doula used across the board. Doula, like a death doula even. And really what I think nowadays the term means is someone to ease you through transitions. Ease you through transitions. Whether it's birth, they ease you through the transitions in birth. Postpartum, ease you through the postpartum transitions. And then outside of this realm, when we see the word doula, it's usually related to these life-altering events.
Yeah.
Where it can be useful to have guidance from someone who's educated and expert in the area, but is also outside of your social circle. And I know that sounds really interesting to say, oh, someone outside, but actually when we look at studies, it is someone outside of your circle. And we think about it, sometimes your parents give you advice and we might feel, oh, that's outdated.
Yeah.
But if an expert were to give you that same advice, you're like, oh, okay, that's good, right? There
True.
is that internal biases we have within our community.
True.
That we don't hold to professionals we hire. And so, to bring that back around. And so the doula is to ease that transition. We're not medically responsible for anything, the traditional doula. As a naturopathic doctor, we do have higher standards of care.
Yeah.
We are medically responsible for the care we provide to make sure if we give you a supplement, make you a recommendation, it is following safe practices. We can be sued, right? Like any doctor.
Yeah.
So we're expected to practice at a higher level of care. So when we do speak about things, it is not just whatever.
Yeah.
We're held to a public safety standard. And that's where not to say all doulas who are not naturopathic doctors
Yeah.
are invalid or
Right.
do that, but that's the little twinge on it on here. And that's what we're doing.
I really like the way that you explained this, right? Like a doula is there to ease you through transitions. And when you say this, there's another point that clicked my mind. I see a lot of moms think that having a doula support equals to a natural birth. This is something that a lot of moms have like prejudice about, right? Let's talk about that and give them an idea that
Yes.
please, that's not what it is, right?
No, I mean, I would say if you would like a quote natural, I like to say intervention free.
Right. Yeah.
Because natural, there's these connotations, intervention free. So if we want an intervention free birth, do I think you more likely need a doula? Yes, simply because there's a lot of support, hands-on, that's required. But can a doula act in other roles? Absolutely. Absolutely. And sometimes it can even be more vital especially in very medicalized births, because what our company is, I feel, or just the doctors we work with, let's say it like that company, but the doctors we work with and the people we really work with, the goal is to demedicalize it really. And so when you have this highly medicalized birth, how do you not fear what's going on? How this transition is totally probably not what you envisioned at all. And how do we connect that expectation to that reality of what is going on? Where do we have control? Or what I think is very important in doula work is witnessing.
Yeah.
Someone there who is not making the shots, although sometimes we might try, to influence or ask questions, but who sees from the outside everything that's gone on, why the medical decisions were made, what were the responses, and the whole context of everything. And in that itself, and the retelling of births, we go through retellings of births, we reduce trauma. And that's really what it is. It's to, like, coming back to this, easing this transition. Doesn't matter if you had the C-section, doesn't matter if you had the induction, doesn't matter if you had a vaginal birth. It's all hard.
Yeah.
It's all hard.
It is, definitely.
And there's all these crossroads of decision making, and there's always comfort needed. There's always questions that need to be answered and asked.
Yeah.
And sometimes I would say, when we look at maybe the OB and nurse system, which a lot of people choose because of the way the care is delivered and available, they're busy. They're monitoring 20 rooms.
Yeah.
The nurses might be, on their 12-hour shifts on break or things like that, and a machine's going off, beeping, and you're thinking, oh my God, is that the baby's heart? Like, what is this? And I'm like, oh no, your IV line is just done. But you didn't know that.
Yeah.
You just hear this loud, obnoxious, constant beeping. And I'm there to be like, it's okay. This is medically okay. There is nothing wrong here. This is what it is. And then instead of sitting, because they don't get notified in the hall when your IV line for 20 minutes being in fear, why is nobody coming? Do I have to press the button? You have someone ready with you saying, oh no, everything's fine. Let me go get the nurse. Or oh, it's actually busy out there. I know how to silence the machine.
Yeah.
Let's
I get it.
continue on.
Yeah, you kind of answered what I was going to ask you, but if I have to ask you like a straight question, why should a mom have a doula? What kind of support a mom can get from a doula?
Because you deserve a positive experience, period. Right? Period.
This deserves applause.
Right? That's why you need a doula, because they are there to make that happen for you as best as we can.
Yeah.
There is always, I say what we do together, and all moms do this, right? You try to eat as healthy as you can. You try to move. You try to follow all the recommendations. All we're trying to do is stack the odds in our favor. And our baby still might have other plans.
Yeah.
And you might do everything right. But you need to know what you can do to stack the odds in your favor, and that's where this doulas can come in handy. And because of that information that you have, and because of that support that you have, you are going to end up with less trauma. Officially, in a study, proven only 50% of Ontarians take a prenatal course about.
Yeah.
It's very low.
Right.
But the number one thing to reduce trauma in a birth is to have a prenatal class. Because you know what's happening to your body. You know what's normal or not normal, or these things. And a doula is there to make sure, again, that this experience is positive.
And the way you said, because you have to have a positive experience, I think that's it. As long as a mom is having a positive experience, it doesn't even matter what kind of birth they had,
100%.
right?
There is
could
no
be-
wrong way to birth a baby. That's if you can take anything away from this,
Yeah.
no wrong way to birth your baby.
Yeah.
They don't care. They don't care how they're born. They just care that you love them,
Exactly.
right? And you can only love them in the fullest capacity if you are supported and you have that positive experience.
Yeah.
Sorry to cut you off. I just
But I mean, I was just gonna say that there are moms who had a vaginal birth and they still think they had a traumatic birth.
Yeah.
There are moms who had an emergency C-section they're still doing okay and they're happy, right?
Totally.
So it really matters what kind of experience you are having, what kind of support you are having, right?
Correct.
And if we talk about labor and birth in particular, what does that look like to have a doula in the room with you when you're surrounded by God knows how many nurses coming in and out, new faces? What does that support look like, and how do you really help a mom who's in active labor?
First, it starts actually before we get to the hospital.
Yeah,
It's when you think you're in labor, you would
Right.
contact me.
exactly.
And we would be discussing, is this early or this active labor? I think some of the best things we do as doulas is keep you out of the hospital longer,
I think so, yeah.
to keep you at home longer. So there's none of this, oh, I went to the hospital, oh, I'm not dilated enough, oh, do I stay here, oh, do I go home?
That unnecessary stress,
Unnecessary
pressure.
stress, pressure back and forth, everything, is to really make sure you're going at a time that you would be admitted to the birth room right away, pretty much.
Yeah.
So it starts there, and sometimes it means we also come to your home ahead of time, depending on how the birth is unfolding, to make sure you can stay at home that longer, right, with that support. But then when we get into the hospital room, there are standard checks that still have to happen with your nurse and your blood work and things like that. And usually we're there sometimes giving suggestions. So an example could be, I had a mom, her labor was hurtling ahead. This was a second-time mom, and she couldn't sit still. But we had to do the blood work. And you know where she liked to sit? On the toilet. So I said to the nurse, instead of trying to force the mom to sit on the bed, could we just do the blood work on the toilet?
Yeah.
Oh, yeah, okay. So sometimes I'm there in the room, helping the nurses do what they need to do in a way can be comfortable for the patient. Sometimes it can look like advocating of saying, the patient really doesn't like IVs. If we're not having a medical intervention, can we not have a port administered? Knowing we can put a port in later if needed, right? Sometimes there's some pushback because it's easier to do it now, get it all done, than later, but it could be something like that. So there's that advocation piece when I'm in that room, trying to make sure things are smoother and convenient for my clients. There's a lot of physical support. So often I'm doing massaging, counter pressure points, putting on the TENS machine. It can also look like bringing water, fanning, affirmations, reminding moms it's not forever.
Yeah.
With my clinical brain, sometimes it is saying, you know what, this is what's happening. And instead of it feeling like a rush, if we're leading towards an intervention that might be necessary, instead of having a rushed conversation 10 minutes before the procedure, I can say, I think this is where this is going. I think these are the conversations that your team's going to be having with you soon. So we have more time to what can we do about it? Can we do anything about it? So we can all think about questions.
Yeah.
Okay, can we just wait longer? Do we have to rush the induction and feel, or to grieve, to cry, to feel ready for the next step? So this can happen if baby's not tolerating labor for whatever reason. Sometimes it looks like it might lead to C-section, right? And I think it can feel very rushed in a traditional, because they have the room, they know what the outcome is. As soon as you say yes, they sign the consent form, and now we go.
Yeah.
And now it feels like a big urgent emergency. And to be honest, we often have time. You just don't always know that. Or sometimes you wait 4 hours waiting for the C-section to happen, deciding if you did the right thing, But if I'm able to be there, I know the process, I medically can assess what's going on, we can have this conversation, and I can say, can we have more time, and can we process what's happening and make peace with it now?
Right.
to the extent,
I mean, even just getting some time to process what's
It's
happening.
huge.
Sometimes you don't even get time to process.
no.
Right? It's like just go, go, go. We go here, then this happens and that happens.
You're not
and
even
then-
in full conscious state when you're in labor.
Hmm.
You're not. You're not your full self. As a joke, right? My husband and I, we birthed our baby boy in COVID.
Hmm.
I'm laboring. It's not like I have my doula hat on when I'm laboring myself, and we couldn't have doula support in the hospital.
Were you a doula back then?
Okay. I've been a doula since 2016.
Wow. Oh, it's going to be almost 10 years.
Yeah,
now.
next year will be 10 years.
Wow.
Yeah, I've been doing this, seen a lot of babies, doing this a while. And he walked me from a parking lot, like far away, to hurry up, Olivia, hurry up, like to the labor room. If I had a doula there, they would have been like, drop her off at the door. What are you making her walk in active labor, right?
Yeah.
And if I was the doula, I would have registered that, but I didn't register that at all, because when you're in that state,
In that moment, you were a mom to be.
you're a mom
Right.
to be, well, you're just trying to
Yeah.
go.
Right.
You're just trying to deal with what's happening, and if someone says do this, you're like, okay.
Yeah. I get it.
You can't always, there's not always immediacy consciousness in your brain, and so it's nice to have other people who know what's going on to bring it in to your brain slowly, to have your best interest at mind, to be able to support you so that you yourself can stay in your zone as well.
Yeah.
Yeah.
And when you were talking about, advocating for the client, right? I understand that the mom and the partner of mom, all of the people around mom would be having like so much respect for you that, okay, we are getting all the support and, this is what we need in this moment. But what happens with other providers? Like, is there
I was
a
just-
conflict or something? I was just
yeah,
got
no, that's a
curious to
great
know.
question. Sometimes yes, sometimes no.
How do you
know,
handle that?
with as much grace as I possibly can.
Yeah.
I'll say it like this. Sometimes it's awkward because the doctors will put a situation forward, a decision, and the clients go, and they turn and look at me like, what do you think, Olivia? And I can feel the OBs roll their eyes,
Yeah.
because they're like, I am the doctor. Why are you asking your doula
Yeah,
for,
I get it.
for your answer? And to be quite honest, there is in the sense of who doctors listen to, there's always the hierarchy. It's actually mom, birthing person first. The patient is the be-all and all first. Then the partner, actually, because they're familial care. The doula is actually last. And so the way we advocate is not necessarily very straightforward, I would say. Like, my client says no. Sometimes it is. But sometimes it's like, oh, why are you choosing to do that? If we had this, what would be the outcome? Could you tell us to get a full
Got it.
informed consent to kind of cue everybody in the room,
Yeah.
in the right direction. But I would say hit and miss. And I would say more and more from when I started to now, a huge shift. So nurses are usually very happy.
Okay.
They have extra hands in the room.
Yeah.
They know that they can get their charting done, basically, like do what they need to do. There is someone tending to the patient.
Yeah.
They feel good about that. Sometimes you have attitudes, just like with any workplace, where some people are like, no, this is my space. Who are you to be in this space? But it's far and few between. Midwives are very appreciative of doula care, very supportive. I don't think I've had any really negative at all interactions with midwives ever. And to be honest, OBs you very rarely see. Anyways. They do their check-in. You might see a different OB sometimes, depending how long the labor goes or with what's going on. You might see different people. So we don't see OBs so much. And yeah, I would say it's depends on the area, depends on how many doulas they're used to, and I think it's But I find it's the quality of my questions.
True, yeah.
When they see I understand what's going on medically,
Yeah.
and they understand that we're all in this together, it's a good relationship.
That could also be because you're a naturopathic doctor.
I do very much think that. That being said, like I said, other doulas might be coming from midwifery backgrounds or nurse backgrounds themselves, so they have that next level. But I understand what the fetal monitor says.
Yeah.
I understand the laws and regulations around consent medically. I understand the medications that could be used. I might not understand everything still because my scope is not that of an OB. But yeah, I ask questions and I have my clinical thinking brain and
Yeah.
and I do think it gets recognized. And I've been at it so long
Wonderful.
that you develop your own expertise in it. And when you
Yeah.
can be in a room with your confidence, with your expertise, just like any human, we pick
True.
that up.
Yeah.
And when people walk in, and I like to think I give off a good presence and they feel my presence, it works. Not to say I haven't had my few,
Yeah.
but it works.
And talking about the emotional effects, like when a mom is in active labor, it's not necessarily that they are very close to, delivering the baby, but then there's too much stress and, pressure. And of course, I personally believe like when you're in the hospital, that itself is a stressful place to be.
Yeah.
Yes, we are not there for something so stressful, it's something else, but
Yes.
it's kind of a stressful place to be, right? People coming in and out with different kind of things going on.
Code blues,
Yeah.
announcements over the PA.
I mean, for me, just the beep, beep, beep monitor is like that trigger, like, okay. How does, what role do you play when you have to, help them calm themselves emotionally?
Great question. I think it is individual. Every family comes with their own needs, right? And usually we communicate that. How do I know when you're stressed? Are you an externalizer, an internalizer kind of a thing? We usually have playlists. Like I tell my clients ahead of time, make a couple different playlists for these types of scenarios that we can play. Let me know what affirmations fit for you. Some people just want body feedback, like take that deep breath, slow down, relax your bum. This won't last forever. And some people have, like I'm a positive ray of sunshine, I'm a birth goddess, I'm gathering all the strength for everyone, whatever that thing may be for them.
All this is like tools for hypnobirthing, right?
Tools for hypnobirthing, tools for birth. We think about birth so differently than any other physical activity. If you had a coach and you were trying to train for something, you got it. Let's go. That's affirmation.
Yeah.
You can do this. How is birth? We need that too. It is something hard.
Yeah.
It's mental. It's physical. Yes, it's emotional. It's everything all wrapped into one, which is why it's such a... And, it changes your life forever. It's not just a
does.
gold medal
Yeah,
or a
definitely.
pass-fail.
Yeah.
It's literally changes your life. And so I help people usually by first being calm myself. Right? When they see I'm calm, they can be calm. We share the emotional space. Returning them to what we call ultimate as much relaxation as possible. So using the affirmations, the music, dimming the lights, massage techniques, all of those things hopefully bring them to a more emotionally calm place. And there's some people who just like everything explained to them. They just want to know everything's normal and understand everything. And as I'm talking to you on this, I'm just talking on, this is what this is what that is. This is normal.
And that's so great because when after the birth, right, if they happen to sit with someone and the other person is like, oh, why did you have to do this? I don't know, I was rushed. That's what they said, right?
But you will know.
Yeah.
Because the doula made sure it was explained to you.
Yeah.
You knew what you were choosing truly. And if it's still, for whatever reason, was a rushed scenario, there's the debrief after, where we can piece together.
After birth?
Always.
That is so important.
It is.
Yeah.
It's. I don't, don't quote, don't quote me on this. Don't quote me on this. I sometimes wonder, the reason why we hear from other moms, oh, you would want the epidural, you're begging for it, or all these trauma stories, is because nobody did that with them.
Yeah.
Nobody took the time to help them process this life-changing event. And we know if we take something like this and we talk about it in a linear time frame, we started here, this happened, we actually put it in the brain in a linear time frame.
Yeah.
And this process reduces the odds of PTSD. It reduces trauma just by linearly going through it and explaining all the scenarios. So it's less likely to have that grip on you
Yeah.
in the postpartum. And I've had moms who've had, yes, I would also say traumatic births where it went sideways, right?
Yeah.
We were not expecting it. The baby that was supposed to be a 63 percentile baby, so like at most 8 pounds, ended up being a 99th percentile baby at 10 pounds. And the sequelae or the things that happened when you deliver a big baby happened. And we were not expecting that. Nobody. And, she's like, I might have chosen a C-section if I had known this baby was so big, because that experience was so hard.
I get it.
Right? And she took a while to go do the birth debrief with me. It was beyond our normal care period, but that's fine. I knew it needed to happen. And we talked about even how do you tell other people about your birth?
Yeah.
Because everyone's going to ask you.
Absolutely, yeah.
How do you honor the truth of what happened without going into the gory details and re-traumatizing yourself? But and put in context, because this mom focused on the one negative thing that happened at the very end.
Yeah.
But they forgot at the beginning we were at home, we were coping well.
Yeah.
We got to this is what we were doing. We got to the hospital at a good time. You got the epidural and got to sleep like you were hoping.
Yeah.
Right? Oh, right. There were still some good parts to it. It didn't so we put that full spectrum there. And now, of course, it won't change it, but it maybe won't seem like we just saw the worst part.
Yeah. And then one thing that I would like to say, Dr. Olivia, that the whole purpose of starting this podcast for me was to create an avenue for moms to, get the resources that they need.
Yeah.
Just get the understanding of what is available for them, right?
Yes.
And this episode was so necessary for me to do, because I did not have that doula support, and I did not choose to have. Not because I didn't want to.
Right.
It was because I did not know what kind of support I can expect, right?
Yeah.
If I had known before, I would definitely go for it, right?
Yeah.
And then I hear all these moms who talk about traumatic birth. I kind of feel that they would not think of their birth as a traumatic birth if they had that doula support who would help understand, like, okay, like you said, these are the things that went sideways. But then on the other hand, there are things that went just as you wanted, right?
Yeah. I wish I could say reduce all trauma. No one can say a blanket statement like that. You could have a doula and still,
Yeah, absolutely.
of course, but
yes.
I think it still eases that for
Yeah.
sure. But yeah, I'm glad you're doing this.
I mean, just processing that trauma, I would say.
yeah.
Let's not say that you will not end up having a traumatizing experience.
Yeah.
There could be more chances that you do, okay? But it is so important to process that.
Yeah, and I'll add to that. The bigger goal I think that we're having, myself and my co-founders, even just reducing unnecessary hospital visits.
Yeah.
Because someone didn't take the time to teach you how to feed your baby, right? Because we think it will just happen.
Yes.
And the doula can help in those areas. And it is very important that you're doing this podcast because we have the same goal, is to tell moms what to prepare for.
Exactly.
We prepare in everything else for our lives. And this part is missed. And, whether it means we actually have to, we spend so much time making teenagers afraid of birth so they don't have kids too early, right? That we've lost where we actually could teach people on a whole about which is high school. It's still free education. Everyone has equal access to it here, right? Outside of that, you have to find your education.
Yeah.
So if we don't teach it there, who prepares you? Who prepares you? The hospital class doesn't even mandatorily put you into stuff. It's still optional sign-ins. And if there's a cost, and there's online classes, but did you even understand what the class said properly? Does it apply to your individual situation,
Yeah.
right? And so, and also, everyone's really anti-co-sleeping in North American society.
True, yeah.
And all the advice you'll get from the hospitals or certain things may say things like that, which will actually make your life harder
Yeah.
versus teaching you how to do it safely,
Exactly.
right?
Yeah.
So there's also biases, and there's biases. A lot of the courses are being taught. I see flyers now of cord blood banking companies funding the prenatal courses, which I'm sure now talk about cord blood banking and
Yeah.
the influence there too. And,
Yeah.
not to say I'm any better. I teach classes that in some ways promote my services, but we need that information. We need accurate
Yeah.
information. We need empowering information.
Yeah.
We need to teach our parents real skills
Yeah.
for labor and confidence. Most important. Most important is confidence. Because it is the scariest thing to think about, I might lose this thing that my baby. And that's on the back of everyone's brain. Am I doing it right? Are they safe? Everything. And the biggest obstacle to some of these happy situations of enjoyment is that anxiety.
Yeah.
Is because people don't feel prepared. Or
True.
again, we talk about, I'm going to say it so many times, the expectations and the reality is different.
Yeah.
Maybe people think my baby's going to sleep.
And thanks
the
to
night.
social media and all the people who are posting, my baby sleep trained at 3 months, or,
Right.
So everybody's prepping for a birth plan and a perfect nursery
Yes.
that has all sort of cute
Yes.
stuff. But one thing that we really need to prepare moms to be, we are just overlooking it,
Oh,
right?
100%. We are at the baby show this year, but I kind of, we did it, Sarah and I did the baby show. The baby show is a convention where expecting parents can come, and there's a whole bunch of booths selling a whole bunch of different services, things, etc. And when I first did it in 2017, 18, I went, everybody is lining up for the free stuff. Everybody, I got a little bit, we didn't do the baby show for a while after that because I was so almost upset that the emphasis was on the stuff. The stuff, the things, the $800, $1,000 stroller, which, kind of works the same as a $200 stroller you got off of Marketplace. These things, and not the services.
Yeah.
Not the lactation consultant, not the doula, not the postpartum meal stuff, And that really sat differently. Exactly. There's this very big market on you need all of these things. You don't. Baby doesn't even care.
No,
They
I would say 70% of these items from the registry, we don't even use it.
Exactly.
We don't.
And what's one thing I'm seeing so much now that there's this basically a baby enema thing.
The cactus, that talking cactus.
The one that goes like if you think your baby's constipated or has that thing, you blow some air in their butt.
Oh no, that's a different thing.
There's a different thing. Okay, no, there's like it's advertised like as a medical tool, but basically to try to give your kids an enema, your baby's an enema. Really, that's all it would do to help them go. If you have a colicky baby or this, well, one, do you feel comfortable sticking something up your baby's butt? No. You're not a medically trained professional. There's a level of that anxiety, but it's listed in some of these online retail stores as necessary.
And it
Part
might
of
not
your
be safe to.
postpartum care.
Yeah. Oh, really? Mm-hmm. I know the brand, even the brand that I'm not going to name or
We're
shame
not going to
anybody,
name the brand.
but I know the brand that is having a necessities kit, and I know.
Yes, and they have these kits, and they put them in the same kind of categories. Even if it's not in the kit, it's in this area that makes you think it's needed. And the amount of questions I've gotten, our collective has gotten, when we see this, and all of us are going, that's not the first thing you would do. That's not even the first thing you would do.
Yeah.
Right?
In terms of pain management, what do you think, like, if a lot of moms don't want to take the route where they have to take the medicine, right? How can we help them?
Yes.
I mean, of course, how can you help them, and how can you help the partner help their birthing partner?
I love this question. We do a class. It's called Confident Birth Class. We call it Daddy Doula training. We give them all the skills they need to do our job.
I love it.
But how you prepare, well, is one, know that's what you want, and do the classes necessary. A lot of breath work, daily practice, or almost daily practice of calming your own nervous system, work on rewiring those inner thoughts of saying, I can't do it, or just the negative talk, the things that could discourage you from pursuing this method of delivery. So working on that level, physically, also seeing a pelvic floor physio is very important. But also moving your body in certain ways, understanding, like your psoas muscle. So there's muscles in your back and in your bum that can affect your pelvic floor. And most people don't even think about that at all.
Yeah.
And how we utilize those or even relax those ahead of time to optimize how baby's in you, to create best room for them so that the delivery is smoother. So to prepare, there's emotional preparation, physical preparation, birth work. There's a lot of preparation that, setting up an ideal environment. Ideal environment could just be space with a ball and a couch, and water is really important. Water, getting in the bath, getting in the shower, and that our partners are present in all of those processes. Because when they're present in all of those processes, and especially what I find is if they're given almost like their own little practical step, 1, 2, 3. Because they won't, if we're talking about a traditional heteronormative couple, men will never give birth.
Yeah.
They will never experience this. They've never had periods. It is out to lunch for them. So how can they even mostly not be afraid? They have to attend the prenatal classes. They have to understand. As soon as she has one contraction, we don't rush her to the hospital because they're too afraid to handle themselves.
Yeah.
So we teach them what's normal. Here are the cues when. Things like when she's still laughing at your jokes, early labor. When she says, shut up, you're not funny, active labor. Those little hints of how we can figure those out and give our partners those tools, they have to learn everything. They have to do everything with their moms. They have to, because otherwise they cannot be the support needed if they don't know what's going on.
And also, they might, what if they just end up feeling like you're replacing them,
Sometimes,
right?
sometimes we don't have to be. Sometimes people hire us because they know they're not capable of that,
Yeah.
and their wives know that they're not capable
And
of
which
that.
is good.
And that's okay. It's perfect.
At least they know.
We know this is your role. This is how you're going to help her, because I can't be that person.
Yeah.
I know, I've had families where it's like, if there's a C-section, I would go because the dads know they could not handle seeing their wife in a surgery, which I understand.
And then doulas are allowed?
Yes, you get one support person, doesn't matter who that is.
Oh, okay.
But it's only one. So
But
you
if
can't have the
husband is
partner,
there,
you cannot also have the
Got
doula.
it, got it.
So there are dynamics where we have the families that they know that their partner cannot be what they need them to be in that moment, and that's why they hire doulas. And there are partners who are doulas, for sure. They do everything. And where I help, or my colleagues can help, is sometimes, you know what, the reality is labor takes a long time. We can't always expect two people, the laboring family, to be up the whole entire time.
Yeah.
And so sometimes it's a takeover temporarily. You rest. You did a lot of support in early labor, dad, partner. Your turn, take a nap. Your wife's in good hands. I'll make sure if it's anything we need you for, we'll wake you. But recoup, because we don't go home with the baby. You guys do, right?
Yeah.
And so we do want a generally-ish, well-rested-ish partner. So sharing the work can be when you have a very adamant partner. And, I would say this is where emotional intelligence comes into play. I've had some families where I can sense the husband is that, and I do that little step back, and he goes that little step forward, and it's that little dance conversation, I'm conscious, and I understand and work it through. But I would say most families appreciate the extra hands.
Yeah.
That's it.
Mm-hmm.